Thank you for staying with us this hour. I'm Dr. Jonas Moses. With me today, Dr. Doron Feinsilber. You are watching In Time TV's On the Edge. This hour we are talking about reflex sympathetic dystrophy and complex regional pain syndrome. I had the opportunity this morning to speak with Dr. Anthony Kirkpatrick, who is the chairman of the Scientific Advisory Committee for the RSD Foundation. And so some of our references are from that conversation. We were, as we were going to the commercial break, talking about some of the long-term treatments, and I had mentioned just before we took a break that there is this psychological overlay, this component, because anything, when you're experiencing chronic pain, this and it's not getting better, and in fact, even the simple act of being touched by someone, renders excruciating pain. It's a great deal of frustration. Your life is being put on hold, and for younger patients, this affects their being involved in school, and really they become shut-ins in some way. And so I was just bringing up psychosocial treatments, and I asked Dr. Kirkpatrick if this would include things like meditation. And he said, well, there are some aspects of it. There are certainly some psychosocial therapies that focus on alleviating, pain, sensation amelioration. And I also asked him about some of the kinds of drugs that might be used along this. And he mentioned anticonvulsants and antidepressants. Specifically, I think he brought up Lyrica as an anticonvulsant and Cymbalta as an antidepressant. And one of the things that he did say about Cymbalta, unlike other medications that are utilized, is that medications tend to cause obesity. The patients will add weight, and Cymbalta doesn't seem to do that. They're also using opioids in treating these, and the challenge there, and we were talking about the commercial break about this, is that there's some subset of patients for whom opioids renders a worse condition. Instead of making it better, they get worse. And there's also the issue of being very careful to give good informed consent to these patients when using opioids, because there are other issues down the line. For example, you can end up being addicted to them.
Yeah. Before I talk about some of the medications, you mentioned something very interesting, and that's the psychosocial aspect of this. One thing that's really important is having a supportive network. And usually one of the first things I always do is I ask the patients, what is your family situation like or social situation like? Does your partner, be it a boyfriend, girlfriend, or even a spouse, uncle, aunt, whatever, you have to know, is that network going to be an integral part of their healing? And that makes a very large difference, because if you can have someone to relate to share your feelings with, and to tell, look, I'm having all these issues. One lady came up to me once and told me that she was actually getting upset with her girlfriends because she was jealous that they could pick up their children when they went and they picked them up from daycare, and she couldn't. And that really, that broke my heart to hear that, because here she was, she had a couple of kids, and her right shoulder was hurting so much that she couldn't actually reach down, pick them up, and be with the other mothers. So there's even subtle things that people don't even think about, and how that can affect a patient on a daily basis, because that's their movement, that's their motility. It can even affect their cognitive function, because their mind is always just set on this pain issue all the time, and it detracts from other things, and that can also be an issue. And so that's stuff that I think really does make a big difference. I refer patients a lot of times to social workers, therapists, and I do think that meditation and things like that do help. I think if you're able to create mental clarity, that is half the battle, right there. But now to go to the more of the, the treatment options. You mentioned already Lyrica. People use an anticonvulsant like valproic acid or Depakote. But again, those are types of drugs that require things like a baseline liver function test to make sure that those are okay. You have to check for blood dyscrasias. So you have to get a complete blood count with differential and try to see if you're not going to have any kind of massive decrease in the white blood cell count. Now the thing is that, and there's another drug called baclofen, which is called it's a GABA.
I was asking about that before. Yes.
Yes, that is a GABA B receptor agonist that will actually cause. Usually it's used for people who have like back or muscle spasms, but that can also be used to lower down the pain for people who have symptoms like this. And in a more extreme example...
And it's considered a powerful muscle relaxant, and typically it's orally administered, but apparently there's been great success or greater success with intracecal administration.
Yeah, that's true. That can happen. But I think in terms of injections, this is what I was going to speak about next, was that generally speaking, if I see a patient has such a horrible pain issue, I'll refer them to an anesthesiologist who specializes in pain medicine. And what they'll do is they'll do something called the ganglionic nerve block or sympathetic nerve block, where they'll take these agents that can cause that type of permanent blockage, like phentolamine and things like that, and actually with a long gauge needle go right under sedation, light sedation I should say, go in and just block that nerve, and hopefully that will do its job. And again, there still is a recurrence associated with that, but it still is a pretty good treatment up till now. You
brought up during the commercial break ketamine.
Yeah, ketamine is it does have some long-term success, but again, anytime you deal with a controlled substance, in fact, ketamine is a also referred to on the market as a vitamin, not vitamin K, but I think a special K. A lot of it's a powerfully abused substance, and in fact, here in Illinois, there's even I won't mention the person's name, but there is a very famous politician here that got involved in a scandal with ketamine. So these are very highly abused substances, and I try to be very careful when I give these types of things to people. Again, just because of their abuse potential, but I'll discuss a little bit later also about the use of opioids and how that can even affect the entire system, how it can affect the brain, things like that, and how withdrawal can be even more dangerous than the disease itself. So.
Okay, we're going to go to a commercial break. Stay with us. You're watching In Time TV's On the Edge. Conversations in Internal Medicine. I'm Dr. Jonas Moses. With me today, Dr. Doron Feinsilber. Don't go away.